Good evening, everyone. Greetings from the Institute of Global Professional IGP Bangladesh. Greetings from the Institute of Global Professional IGP Bangladesh. Thank you all for joining us and staying with us till the end. Honorable knowledge seekers, today I am your host for the evening. My name is Yarni Sattar and I am from Bangladesh. Dear knowledge seekers, I am proud to be associated with IGP as a global member. IGP, a non-profit organization, is a social and ISO certified international training institute. In 3 years, we already served 3 million knowledge seekers from 100 plus countries. IGP is internationally recognized and globally accredited. We are connected to more than 250 plus professions and 4,500 plus organizations. Institution of Global Professional IGP and ISO 9001 2015 and 10002 2018 is a training faculty for skill development, which was founded in 2020 and is generating competent candidates to meet demand in the global labor market by providing professional qualification. The Institute of Global Professional is an educational institute that provides social work globally recognized and reputable. We serve student and community resource, providing holistic social work and education. We believe that it is not effective to increase one skill just by acquiring formal education. So we provide effective training and consultation to generate profession generation all over the world. We distribute our service locally, nationally, and internationally to students, job seekers, job holders, and also for learners through respective campus location and distance learning platforms. We are an occupational and dependable institution. IGP is one of the famous online institutes from all over the world. Our vision is education is not a business product, it is a part of our human rights. Based on our vision, we are trying to reach all corners of the world. For free webinars, seminars, courses, awards, quiz competition, mentoring, and counseling aids. On the other side, we also trying to serve more than 100 premium services for free like create own portfolio website, resume builder, cover letter, motivation letter, and world knowledge platform for gathering general knowledge which an upgrade all day. Kids learning games website, free courses, converter sites, and many more. We have to empower youth to learn to meet their expectations and dreams and become highly skilled people. We implement several trainings, programs, webinars, and offline online courses for youth and learners by professional trainers, speakers, and coaches. Our sessions are conducted by globally renowned professionals to develop all kinds of youth and to promote the education of their abilities and personalities. To ensure excellent and in-depth instruction, we arrange with qualified trainers, speakers, and instructors. We extend free services to more than 3 million knowledge seekers in last 3 years. We have affiliation with universities and organizations in 70 different countries. Virtual mock signings with many colleges and organizations have been accomplished. We are working to create a legendary generation of future scholars and citizens who will be accountable. We are constantly prepared to assist all knowledge seekers with valuable service. Spreading knowledge is crucial for the Institute of Global Professionals. We believe that knowledge is love and light and vision. So we try to understand the needs of today's generation and we serve them with good research and practice methods. We must have a genuine concern for the learners we represent. More diversity, growth, and innovation are required. The leaders session with professionalism, passion, and integrity. IGP members are committed to offering effective, best quality service and continual improvement so that individuals who seek information can improve their skill levels and value. Before we move to the next, let me remind don't forget to share, tag, and mention your friends in the comment box. Your support is very valuable to us. Before we move to the next, let me remind don't forget to tag, share, and mention your friends in the comment box. And your support is very valuable to us. Thank you. Moving to the next, with your continuous support, we already completed 1,139 webinars successfully. At present, we are going to start our 1140 program and name is Nurses Angels for Everyone's Health. And our today's speaker name is Dr. Shonil Malhar Kulkarni. Before I hand over the stage to Sir, want to share a very little about our speaker. Uh, our speaker is from India. He is the assistant professor of VBDO College of Nursing, Sanglai. Now, very important moment for me to invite our speaker to IGP with his presentation. Now, very important moment for me to invite our speaker to IGP with his presentation. Hello, sir. Sir, you. I can't hear you. You are
Yes,
on.
yes, yes. And
Oh, okay. Hello,
now
sir.
hello, ma'am. Good evening.
Good evening, sir. How are you?
I'm fine, man. Enjoying with this organization.
Okay, sir.
Almost one
Uh,
year over.
yes. Sir, on behalf of IGP Knowledge Seekers, wants to hear from you about you.
Okay, ma'am.
Sir, can you hear me?
Yes, ma'am. Shall I? You
Uh,
can hear and see me.
yes, I can.
Okay, ma'am. Shall I continue?
Yes, sir, you can continue. And please say something about yourself, then you can start.
Oh, okay, ma'am. Sure.
Okay, thank you.
Okay. Thank you. A big global profession, as the name says, it is worldwide covered. I'm Mr. Sunil Kulkarni, Dr. Sunil Kulkarni, working in Bharati Vidyapeeth College of Nursing, Sangli in Maharashtra. India. I'm a nurse, and today's topic is related to my profession, so I'm very happy to interact with you regarding this profession. I'm working last 30 years in this same profession as a professional. I'm teaching, helping for the research, performing various administrative activities, as well as I am performing social activities through our community health nursing programs for the various age groups, various settings, and different areas. I'm guide for UG, PG, and postdoctorate students. Those are studying in nursing. And very special, I have joined this institute 1 year back, and I am satisfied with their interaction. With this short introduction, I'm starting my presentation. Health is a fundamental right given by the Constitution of the nation. So every nation's constitution gives a fundamental right along with the other health. So healthy person maintain of the health, it is a fundamental right of each and every individual. Health team includes doctor, pharmacists, technicians, and very vital and special member is a nurse. Nurse take care before birth, during life, and after birth. So during pregnancy, we are taking care. During living and even after death also, we are taking care of the dead person. Nurse takes care of all, always, and by holistic way. Nurse takes care of all means all age group uh, without discrimination of any demographic. Always 24 hours into 7 into 365 and the holistic way means we are considering all the needs of every individual before birth, during the life, even after death. These are the few points of my today's presentation. First, concept of nursing. What is the nursing? What are the different nursing programs are there in the various countries? What are the roles and responsibilities of the nurse? Roles, what she is and what she works, that is the responsibilities. Scope of nursing, where the nurses are working. Code of ethics, how nurses are working by uh, accepting the ethical, moral, legal, social rules are there. And challenges and trends in nursing. Challenges, what problems occurs, how they are solving. Trends, what changes occurs because of environmental, technological, and day-to-day changes occurs. Occupational hazards, when any professional is working, some health problem occurs. Same to the nurse also. And present nursing image, how is the nurse in the society. Go back to the history of nursing. Nursing has very long history. Nursing is oldest art and youngest profession. In the 19th century, mainly it is developed. Before that, it was like art from the tradition, mother to daughter. They were performing various activities of taking care of mother. Mother is the first nurse, and the nurse is the second mother. Mother is the first nurse, so every mother take care of the child like a nurse. And nurse is secondly mother. Like mother, nurse is taking care of you when you are healthy as well as sick. In 1981 in India, the by Krishnabai Ganpat, who was the first Indian nurse, came from training. It was before independence, and it's very difficult in that situation to take the education by women. I think it is same situation overall the country, overall the world. And in 19th century, the special recognition for nursing it is given by the pioneer of modern nursing, Miss Florence Nightingale. Miss Florence Nightingale, who also known as Lady with the Lamb. Lady with the Lamb because she has taken the wounded soldiers' care by using a lamp because in those days there were no bulbs and other things. With the lamp, she was taking care of the wounded soldiers and she has started nursing schools. So nursing, it has a different meaning and different definitions are there. The meanings like nourish, feeding, giving the health services, cherish, make the people happy, supports in the healthy way as well as in when it's sick or in disease, helping maintain to sustain the health, conserve the energies, whatever the potentials are there, disturbed by the disease or injuries, nurse is helping to reverse it back or preserve whatever is available and help for keeping good health. Health considering all the aspects are there. Whatever our body is there, mind is working, what we are thinking, what we are working, we are taking education, relation, social interaction, social uh, activities are there. So in each and every activities, it is directly or indirectly take care. By the bookish definitions, nursing encompasses the autonomous of the collaborative care of individual at all ages, family, groups, community, in sick as well as well in all the settings. So nurses takes care of all the age members, all the families, groups like ANC group, in the workers group, or different type of groups are there, communities, and they are taking care and sick or well in all the settings from the home, school, industries, road, anywhere it is there. Nurses includes the promotion of health, improvement of health, prevention of the illness, not convert into the disease, taking care of ill, disabled, and even those are dying, nurses are taking care. The third definition is given by International Council of Nurses. That is one organization, all the nations, nurses organization connected to that. Advocacy, promotion in the safe environment, research, participation in the shaping of health policy and in the client and health system management, and the education also key role, key nurses role. So advocacy means working for, speaking for someone. For what? For promotion of safe environment. So in which we are living, working, that environment should be safe. We are conducting various research for the comfort, participation in shaping health policies at the national level, state level, or district level. The policies are formed. Nurses are giving the guidelines how what or how the policy should be there, and the client as well as health system management. So structure and function of health system also important, and nurses' role is important in providing health services. So why to do nursing? As mother is the first nurse, or there are so many members are there, especially the woman, directly or indirectly they are providing nursing care. But as a professional nurse, why it should become? There are some reasons, there are some benefits. First, care of human health needs. So we are taking care of the human, so it becomes a noble activity as well as we are helping the human. We get the satisfied, and we are thinking by our culture take care of the human beings. And this nursing care is essential for all time, everywhere. There is huge level of the job satisfaction as a nurse. When you are working, you are performing various roles as a child, as an adolescent, as a mother, as an old age members. When you are taking care and the patient recovers, person recovers, feel better, a single smile of that person gives the highest satisfaction. Fantastic progression opportunities are there. Later on, we are discussing there are various areas, various levels are there. We are getting different type of the jobs. So fantastic progression is there in the profession. Economic stability. So every nurse, when they are taking education or taking programs, they will get the service as well as some of that they can work independently. So economic stability is there as work availability is there, and there is high demand for job. Noble profession, as it is taking care of the human being as well as now it is involved of all aspects like environmental health as well as social health. So social health, human health and environment health. These main products are there. There is wide scope of working. So you can work everywhere in the world. Everywhere in the world. It is home, it is school, it is industry, it is certain public places are there, it is different hospitals are there, hospital settings are there. So many areas are there where you can work. So wide scope is there. Work in anywhere in the world. Job security is there. So there are opportunities are there, demands are there, and once 1,000 year back, 100 years or 1,000 years ahead, also nurses will get the job because it is related to human health and it is need for everyone every time. Respected career is there. So when the person recovers or uh, relieve the pain, the person gets feels and gives the respects. Even single activity in the life also they will remember long time. Flexible of the works according to the demand, according to the nurse, they can work maybe short time, daytime, on call time, or other certain opportunities are there. Multiple choice of the specialties are there, and it is a challenging job. When you are taking the challenges, you will enjoy it, you will increase the potential. So in short, you are getting job, you are getting status, you are getting noble professions, opportunities are there, you can work anywhere, and there is continuous demand is there. There are different nursing programs are there from the bottom to the high level, starting with the auxiliary nurse midwife, that is ANM. 1.5 year program is there. General nursing and midwifery 3 years program is there. After that, basic or post basic BSc nursing program is there. It is a 4 years program. Master in science or nurse practitioner in critical. These are the post graduation programs of 2 years are there. MPhil, again it is 3 years program is there. PhD nursing and even the postdoctoral programs are there. So from the ANM to the postdoctoral programs are there. This is the highest level. There are some parallel programs are there. These are the parallel programs are there for various nursing specialties are there, like cardiothoracic nursing. Cardio means chest, heart and chest related services. Neurological nerve, brain, spinal cord, nerves. Third is the midwifery care, taking care of the pregnant woman, delivery and after delivery. Psychiatric nurse, maintain the health of brain or mind as well as recovering if something disturbances are there. Critical care nursing, when there are poisoning, accidents are there, or by any reason life is in a threat, that is a critical care. Emergency and disaster nursing. So this is needed whether different type of the disasters are there, natural disaster or man-made man-made disasters are there, like wars are there, earthquake, flood, cyclone, tsunami. Oncological nursing, that is different type of cancers, how to prevent it, what are the different therapies are there, how to maintain their health. Operation theater room nursing, so where different type of operations are done, assisting for the operation before, during and after. Geriatric nursing, taking care of the old age group. So it may be daytime, short time, or it is full time geriatric nursing care. Neonatal nursing, neonatal means the age group of birth to first month, very crucial stage of the life. So special nursing is provided. Forensic nursing. So whenever we are performing any activities, law comes in that. So how to legal procedures, each and every activity we can perform or what is needed for the law action. We have to preserve the record, reports or samples. That comes under the forensic nursing. Then blood related specials are there. Burn and reconstructive surgeries are there. Reconstructions and orthopedic and rehabilitation nursing is there. So there are different specialties are there. Super specialties are there. So that is a wide scope is there. So how do you will become the nurse? There are certain steps are there before come to the nursing, entering into the nursing to get a nursing register certificate. So there are various nursing programs are there. There are certain members are there online, some guides are there, institutions are there. They are helping to choose which and where you can perform the various nurses programs are there. Then prerequisites for the nursing they are needed. It may be entrance exams or it may be certain interviews are there. Then application for the admission. So admission process it may be offline or online. You will interact it. After admission process again there may be specific entrance exams are there at the national level, state level or institutional level. By the ranking of the entrance exam interviews they will select the members according to their permissions, and these members they will enter into the particular educational institutes and they will perform the nursing programs for diploma 3 years, ANM for 1.5 year or basic as a BSc nursing. Starting these 3 points are there 4 years, and once you are completing the programs you will get a certification by the state nursing council, state nursing council, as you are registered nurse or whatever your additional qualifications are there. So certain steps you have to follow before that preparation process. Especially you can have the exams, getting the course completions, and getting the certification. Without certificate, you cannot perform the professional activities. Who are the agencies controlling the nursing education programs? Mainly there are three at the state level, state nursing council. State nursing councils are there. Some areas there may be provinces, some are the central governing areas are there. So centers they are controlling the. Secondly, as I'm Indian, so I have written Indian or National Nursing Council. So all the state nursing council come under the National Nursing Council. And third is International Council for Nurses. So all the nations becomes the member of International Council for the Nurses. These three agencies they are directly and indirectly controlling the nursing programs as well as profession. Some other agencies are there as associations, nursing associations are there. They are also helping to form the policies to guide to the government for making certain rules, regulations, or certain welfare services, as well as nursing federations are there at the institutional level, state level, to interact with the management and getting the welfare of nurses. For example, I have mentioned here Bangladesh Nursing and Midwifery Council. It is a part of ICN. Sorry. At the international level, International Council for Nurses is the federation of 130 nations are there and they are representing of 28 million nurses worldwide. The ICN is operated by the nurses and leading the nurses internationally. So internationally they are providing education, policies, material and some information regarding rules and regulations. ICN is founded in 1899. It is the biggest and widest because it is the connection of all nations. What are the functions are there? So at the international level, it maintains nursing quality or standard overall the world. They are forming the different policies at the globally level and sharing to the each and every country. Whatever advancement is there regarding the knowledge, regarding the skills, they are sharing to the all members. They are representing the words of the getting the activities to respect the nursing professions. They are helping to frame the welfare services and get the satisfied nursing workforce. They are conducting programs, projects for nurses related to the nursing profession indirectly benefit to the each and every member. Second is at the national level, that is the National Nursing Council. It is an autonomous body, independent. They are working under the central government. For India, it is the Indian Nursing Council, works under the government of India, Ministry of Health and Family Welfare. It was constituted in 1947. What are the functions are there? It recognizes the all state nurses as the same uniform standardization there. Regulate the nursing training institutes. So periodically they will check up and control of that. Constitute of the different syllabus of different programs. Permits to have a special titles according to the education. Then these having the authority after inspection to permit to continue or to promote the nursing institutions or working hospital areas or health settings are there. They are regulating the nursing practices. So by law they will perform what are the code of conduct for working as well as some special standard of nursing activities are also they are taking actions. Power to make the different policies related to the nursing. Maintain the register. How many nurses are there in the world? What are different cadres are there? Or and inspection of various institutes to promote their functioning. Third is the state nursing councils are there as a part of the states. Mainly they are controlling the state nursing activities, institutions as well as various settings are there. Mainly they having the function safeguard of the health of society at a large of public interest by regulating the nursing profession. So education, regulation, inspection and promotion of nursing for health of the society. Providing the higher standard of the nursing and midwifery education. So at the basic level it may be ANM, GNM or basic BSc nursing. It is a foundation. There are super specialties are there or there are some specializations are there. Organization body at the national level there is one. It is autonomous body independently working by the professions. They are so working in continuation of the national or state councils along with International Council of Nurses. What is their functions? To establish the standards and qualification of nursing education and practice, to establish the code of the profession, code of ethical conduct, to stimulate and promote the research activities, to perform the research, it will promote the economical way and comfort of the life, to promote the legislation, to frame the various legislation to protect the for people as well as nurses. Also, they will speak for the nurses as a legislative action. Promote and protect economical welfare of the nurses. Welfare of the nurses, they will take part. Provide the professional counseling and placement of the services. So they are giving advertise. There are interviews. There are certain programs are there through that they are motivating for the young generation enter into the profession professional members go high and high specialty or subspecialties are there. Promote the general health and welfare of the public. That is the main motto of nursing. Who can provide the nursing education at the basic level? So mainly four agencies they can provide. One is the central government or state government or local bodies. Government bodies are there. Secondly, registered private or public trust agencies they can provide the nursing institutions. Organized registration of the societies under the Registration Act, including missionary organizations are there, different professional missionary organizations are there, or religious missionary organizations there, and certain companies, industries areas are there, they can also establish the nursing institute to run the nursing programs. They will start after getting the essentiality or no objection certificate from the state government and permission of State Nursing Council as well as National Nursing Council. Beneficiaries of the nursing services. The beneficiaries, almost each and every member is the beneficiary for nursing services. All age group. So from the day of 1 day of the birth or before birth till death and after death also. Nurses providing care to the sick member as well as well. Healthy, promote the health, sick, recover the sickness. They are working at everywhere, home, school, working place, and all the health settings and almost everywhere when they are in a group. They are providing four type of services: preventive services, not to have sickness, disease, injuries, or any psychological problems. Promotion of the health. If disease occurs, treat it, curation. And rehabilitation services. Rehabilitation means whenever disease occurs, certain parts, certain areas of the health will not perform. So get the training and recover maximum. Nursing is a profession, noble profession, very highly respected profession is there. Why it is called as profession? Because nurses fulfill certain criteria of the profession. Which are the criteria are there? One is the specialized knowledge and skill. So there are certain programs are there, trainings are there. When you are undergoing this training, fully skillful, knowledgeable person only work. No other person can perform the activities. Secondly, all the nursing they are basically service oriented. So service first, you, your family, and other things are next. Then every nurse is accountable and responsible for the work. So whenever they are working, they are accountable for the work and they are responsible why they are done, why they are assigned, how they are get it done. Next, they are practicing code of ethics. So it is regulated by the morals as a human being, ethics as a profession, social conduct as a society member, as well as professional, and lastly the legal. It is a developing continuously. So it is developing in the area wise, covering the whole world, as well as higher education specialties are there. So it is continuously developing because there are trends, changes occurs in the health, health of individual, health of the environment, health of the society. So that's why it is called as nursing profession, and nursing is a noble profession. What qualities should be there in the individuals or youngers? Those are entering or during the programs, they will develop certain qualities. First and very important is that maintain good health. So nurse should be healthy. If nurse is sick, she will not able to take care of others. Sometimes it is there because every nurse is also human being. But she has to maintain their health, take the protection to avoid injuries or sickness. Second, update the knowledge and skills of nursing. So it may be 10 years before you are taken the education. After that, every month, every year, various activities you have to perform to maintain your knowledge up to date and skill. Then there should be sense, special sense of love, honesty, loyalty, assertiveness. Assertiveness means you can uh, say your feelings, expressions in a polite manner and maintain the empathy, taking care as I'm taking or every individual is taking care for self. Then it he or she should be resourcefulness. Resource in terms of 6M, we are considering it is a resource of man, money, material, measure, methods, minutes. So these all resources should be provided by the nurse. Discipline. So discipline on the working at the home as well as wherever she is there. Maintain the disciplines of profession, society and home. Take the responsibility and accountability. So just performing or delegating the work, no, they have to take the responsibility of their juniors and the students, those are working, as well as he is the accountable for each and every work. Maintain good interpersonal relations because this is related to the human being and it is a holistic care. We are considering all the aspects of health physical, mental, social, educational, professional, or occupational, legal. So, all the ways when you are interacting with human being, very important is interpersonal relationship. So even especially foreign countries are everywhere nurses are preferred than the other health team members. It doesn't mean that other health teams are members are also having the importance, but preference is that because of certain interactions or actions of the nurses. So nurses take care of all human health needs. Not only they are the treating the disease, they are taking care of human being ready for work at all the places like 24 hours into 7 into 365. Perform the multiple tasks. Later on we are discussing what are the functions are there, what are the roles are there. Then cover all type of services, preventive, promotive, curative, rehabilitative. Having specialized knowledge and skills. So nurses they are undergoing various programs are there and continuing nursing education is there as well as super specialty programs are there and it is a cost effective. It is a cost effective nurse is working at each and every level, each and every place. The services what we are has a prevention of many diseases. So it is a cost effective care. What are the functions of the nurse? There are so many functions are there. Few of that I am mentioning here. First and important that implementing of the nursing care. Total nursing care. It is there taking care of the body, taking care of the mind, taking care of the functioning of the various body parts, taking care of functioning of the mind as well as social relation interactions. Secondly, administration of the medications. It is different type of medications are there, different routes are there, and different uses are there. So very carefully, cautiously, rightly they are providing the medication ordered by the physician. In some countries, some medications will be given by the nurse under her authority. Collaboration of the health team members. So that's why it is called as backbone of the health team. Nurses are the backbone of the health team, like our backbone, which connects head, arms, and the ribs. Other things are there. Same like that, whole health team is connected, coordinated, and cooperated by the nurse. Provide the comfort in each and every situation. When they are wealthy, they will provide the comfort for the further actions, sickness, illness, by them taking various measures is the pain. It may be physical pain or it may be psychological pain. Providing the health education and health advice to prevent the disease. Simple ways prevent the disease. If occurs sickness, giving also advice to treat it at the home level at till the hospital. And in hospital, preventive curative services are provided. Also, she is teaching, administration, research activities are there, and she is performing some professional activities to maintain her profession. Teaching the home care. So, for prevention, she is teaching at the home. After discharging from the health units, health setting, patient come at the home. So, nurses they are teaching them how to take care of themselves at the home. Advocate for health and well-being. Advocate means speaking or reporting for the patient, to the doctor or any other agencies. Educate to the staff and students. It is a knowledge related or training, teaching of the skills. Maintain the various records and reports. Very important are there. These are guidance and counseling for professional patients and patients' relatives are those are coming in contact at the home, school, work, industries or everywhere and they are participating in the professional activities. Roles and the functions of the nurse. So as a nurse, one is there, but at the different level, at the different situation, they are performing in a different way. In addition to the basic care, so these are the certain roles are there. These are two types of roles are there: extended and expanded. Extended and expanded. Expanded at the same level, they will have additional activities are there, and from the bottom to higher level are there. So, for example, basic is the care provided. All nurses are responsible for all type of roles. Care provider is the top of that. So, preventive care, promotive care, curative or rehabilitative care has to provide by all nurses. It may be NM nurse or it may be postdoctoral nurse. So educate to the patient relative, patients, persons, professional members, paramedical members are there. Advocates speak for the patients, reporting to the various health team members. Managers at the staff nurses, unit level hospital, wards, or at the hospitals, at the state level, district level, national level, even at the international level. Collaborator is there, so she is collaborating to the health team members, paramedical members, and other members out of the hospitals who are indirectly connecting to the patient care. She is also working as a leader, so she will interact with the uh, professional members or agencies for the welfare of nursing staff. Researchers perform the various research activities, sharing the research activities, teaching or guiding of research activities. In addition, some special work she is performing as a nurse practitioner. Independent nursing activities will be performed by the nurse practitioner. And there are some specialties are there in nurse practitioner course. Then clinical nurse specialist in the different areas are there. It may be cancer, it may be mental health, it may be oncology, like that. Nurse midwife taking care of the NC before, during, and after labor. Nurse educator, nurse researcher. So each and every area there will be specialized roles are there. In nursing, we are considering certain areas like nursing practice, perform the nursing care, nursing administration, so providing the members and resources to perform the nursing activities, get the work done. Nurse educator teaching to the relatives, patients, students and society members. Nurse researchers performing the research activities. Then professional activities as it may be consulting to the nursing professions, it may be writing certain member, publication of the various articles, books are there, and advertising of the nursing professional through various mass medias. Out of that, first is a nursing practice, actual nursing care in different settings. So she is providing nursing care at school, home, industry, public and private, various health settings are there. She is taking care of all the peoples. She is taking care of sick as well as well members, providing the services like preventive, promotive, curative, rehabilitative. She is performing dependent and independent nursing care. Dependent means along with the health team members, and independent means she is working certain nursing activities as an individual. She will not depend on any other member. Take the decision, perform the actions. Safe and standard nursing care. She is providing safe and standard, safe for the both as well as the consumer beneficiaries as well as nurse or colleagues. And standard means as it is taught or maintained by the professional agencies. Regarding nursing education, institutions are there, or it may be small units are there, continuing nursing education units are there, or some educational activities are there. It may be workshop, conferences, seminar, webinar, or exhibitions are there. So teaching to the various professions programs from A&M to the postdoctorate level, teaching in the classroom or each and every clinical setting, wherever she is performing the activities. She is teaching curricular as well as co-curricular subject which is complementing to the profession. She is teaching online as well as offline or distance education. For the nursing research, she is performing the roles or actions, conducting of the various research, guiding for the research, UG, PG, postdoctoral or any agencies, consultation for nursing researchers as well as it may be inter professional or inter institutions or as a governmental health projects are there. Communicating the research activities through maybe presentation, publications, or directly implementations, and teaching of nursing research as a theory. Nursing administration as administrator level from national level to the unit level. So what hospital, state health institutions are there providing all the resources. Providing all the resources like 6 CMs are there and get the work done or nursing care. She is administrating on the job training programs because new members are there or advanced skills. It has to taught on the job training. And lastly, for the professional developments, maintain the professional relationship with the professional as well as each and every member. Become a member of professional organization to show the unity. Unity is the strength or power. Practice the code of conduct. Whatever is professional has given the rules and regulations for the behavior of professional activities. And she has to maintain the licensing and renewal of licensing of each and every program according to the state policies or national policies are there, or if she is shifting from one nation to the another nations, wherever she is working, she will follow the policies of licensing and renewal. Scope of work nursing means where the nurses can work. What are the different areas are there? Few I have mentioned here, but in short, I can say she can work everywhere. She can work everywhere. Training institutions as educator, she is working. Home, palliative care, mental health nurse, pediatric units are there, or pediatric hospitals are there, clinics are there. Then this is a traveler nurse are there, different type of travelers, especially airport, plane, critical nursing areas, disaster management, first aid and disaster management, authoring, writing certain books are there, consultant to start the different programs are there, or consulting for the special professional activities, ambulatory nurses, neonatal, cardiac nurses, cancers, it may be one type of cancers or all together. Researchers, industrial area, geriatric nursing, old age group, at home or in a geriatric homes are there. Nursing homes, clinics, or certain health departments are there. Orphanages, old age homes. As a community nurse, she is taking care of schools, health advisors are there. Military nursing, especially military different areas like Navy, Army, and industrial nurse, railway nurse. So in short, she is working everywhere wherever there is organization. Those are running. Okay, these are the special areas and some special pictures are there at the home level. She is providing these few activities are there. It may be taking some investigations, then helping to certain activities, directly providing nursing care, rehabilitation, physiotherapy is there. Whenever there is critical care is needed, she will take care of that or shift it to the specific area and consulting to the physician. At the school level, she is performing certain activities like prevention uh, of the sickness and illness of the children, because this is a very important at the foundation of the life. If the children are healthy, lifelong they will be healthy, and healthy children, healthy adults, this is the wealth, or this is the power of nations. Their whole education work is totally depends upon their foundation at the primary level. So it is preventive services, promotive services, early detection and treat it, and rehabilitation services. At the industrial areas, there are different industries are there. So she is working with the different roles and different functions. Like as a personnel, she will provide the nursing care, employee assistance, as a counselor, how to do the work, what are the safety measures are there, what is the importance of that, special taking care of worker and their families, working as a supervisor or manager to provide the various health services, or industrial health, industrial hospitals are there, or there may be small clinics are there providing certain medications, maintain a hygienic way of industry, cleanliness is there, light, ventilation, temperature, sound, as well as air. Then for the legal actions, there will be nurse and law. So what are the legal forensic activities you will take care part. Safetyness of the professions. Public health nurse, these are the different roles. Already we have discussed it. Preventive care, coordinate, lead, advocate, integrate all the members, educate, protect all the members, promote, providing the care, and research activities are there. The nurse, she is following moral as a human being, then ethical, professional, certain rules and regulations, social rules, norms are there, as well as legal, all the. So here, code of ethics means what are the different rules are there, what are the standard actions are there. They have to perform. These actions are related to the people, related to the nursing practice, related to society, related to the co-worker, and professional members are there. Few of examples I have taken here. So how nurses are performing along with the patients. So nurses' primary professional responsibility is to care of the patient as in the form of individual, families, communities, or whole population is there. They are taking each and every actions for promote of the environment where the human rights, values, customs, religion, spiritual beliefs will be maintained. So with the maintaining all these human rights, values, customs, religious and spiritual beliefs, they are performing the activities. And very important, respected care is provided. Follow the all ethical principles. It is autonomy means the family member, individual, they will take the decisions. They will not expose whatever the information is given by the individual or family members, that will be taken for the health care purpose. Then nursing and practice, how they are practiced. Nurses carry personal responsibility and accountability. So each and every activity, whole activity, all together she is responsible for nursing activity herself, as well as those are taking care under the nurse, head nurse as a manager. Nurses share the knowledge and provide the feedback, mentorship, guidance to the professional development. So she is providing the knowledge to all members, taking the feedback of each and every members, so they will improve in the sharing of knowledge or content of the knowledge. Mentorship, especially the new professional, they need the mentorship or special skills are there as you go higher and higher. Mentorship is needed, guidance are there, and helping from the professional development. Nurse maintains the person's rights are there. So person's rights take the decision, refuse the any decisions, whatever they are asking for their care, they are providing the documents, other things are theirs, and according to their choice and their beliefs, they will perform the activities. Maintain the good interpersonal relationship. During the all practices, nurses are the active participants in promotion of patient safety. So health and environment aspects. Suppose he is working in the industry, nurse will take care of air, light, ventilations, machineries, covering, use of the safety measures. So all the comes under practice. Third is the professional activities are there. So nurses are the active members to developing their professions by updating the skill, knowledge, maintaining the professional behavior, code of ethics. Nurses contribute the positive and ethical organization environments. So positivity is important. Self positivity along with the positive regarding the health of each and every individual, society as well as environmental health. Nurses engage in the creation, dissemination and research. So they will create, get the new knowledge, share the new knowledge or conduct the research activities. Nurses and global health. So every nurse directly or indirectly related to each and every members. Like Corona has gave the example. Something happened in a China, it spread over all the world. Same like that. So global, we are saying as a world is a global village. Global village. We can communicating to each others very fast and for each and every purpose. So nurses must uphold the dignity, freedom, and worth of the human being. Respect to self, respect to the others. Nurses lead or contribute the health policy development. Health policy for the each and every member as well as policy regarding the profession, health profession. Nurses recognize the significance of social determinants of the health. Social determinants, especially the environment, social interactions are also very important. Social health. Nurses collaborate and practice to perform the preservative and sustain, protect the natural environment. So environment is also contributing the health of the each and every human being. So nursing, as I told, it is uh, getting the opportunity at the various level, and few of that, especially everyone is craze having preparation for the foreign nursing. Foreign nursing, especially the European countries, Gulf countries are there, or you can go anywhere through certain WHO, World Health Organizations are there, or certain health related organizations are there, or sometimes the special care. Some nations they are asking to get their services. There are certain steps are there when you are planning for foreign nursing opportunities. You have to apply online for particular nursing program for the particular nursing services. Then you have to undergo certain exams are there to maintain the standard, to the equalization, to test their knowledge and skills and other nursing and non-nursing skills. So the exams like IELTS, HUD, MOH, NCLEX, CRANE or Prometrics. Then certificate verifications, whatever you have taken the education experience that will be verified by the particular foreign agencies or their appointed members. They get the appointment and when you are getting the visa and passports, they will permit you to enter the particular nation and perform your services. Especially for the exams, online exams are there. These exams, various nations they are taking different type of exams like Health Authority of Abu Dhabi HUD exam they are conducting, Prometric exams Saudi Arabia is taking, Supreme Council of Health Qatar testing SCH exam is there, Dubai Health Authority that is DHA exam, Canadian Registered Nurses exam Canada they are taking that is a CRNE, and CLEX USC they are taking National Council Licensing Examinations. They are performing interviews are there, skills are there, and other exams are there. And some nations, especially European nations, they are uh, maintain the criteria like IELTS examination, IELTS International English Language Testing Exam. international English language testing exams. So certain exams they have to perform and professional along with other skills, then you will be able to get the foreign nursing chance. Every profession there is challenges, and challenges you have to take it, face it, because you will get the solutions, you will improve your powers, you will get rewards when you are facing the challenge, and solutions are there. As one someone has rightly said, solutions comes before the problem. Solutions comes before the problem. The best example, whatever I had, that is before birth, mother getting breast milk. The solution is already there about the feeding before birth. The solution is there. So it is for each and every challenge there is solutions. You have to find it or you have to make it. So what are the challenges are there? Long working hours. Long working hours by the labor organization they are saying around 8 hours per day, 48 hours per week. But practically each and every nurse is working long time. 8 hours exactly she is working. Before that taking over, handing over on some other responsibilities, and whenever emergencies are there, they are working long time. And the long hours, it may be some additional assistance they are asking by the authority. Second, maintain the healthiness. So every nurse she is working very hard and workload and the situations it may create some disturbances to maintain the very uh, difficult in the maintain of the health, but she has to maintain the health, physical health, good nutrition, exercise, recreation, relaxation is important, and learning of the professional knowledge and skills. Workplace hazards. So wherever she is working, certain hazards are there. Later on, we are discussing this point. What are different hazards are there? For example, when you are doing performing, it may be physical environment. Certain problems are there. You are handling so many drugs, chemicals. There may problems are there. Next is the bullying and harassment. Bullying of harassment. It is a small point is there, but that point should not become as a circle. So it has to dissolve there and there. So it is total responsibility, especially at the management level, to assess, to take the preventive actions, educate, not to have bullying or harassment by any, because by the law it is totally prohibited. Any single event, small event also get high punishment. Shortage of the nurses. It is shortage in number of the nurses according to the standards for the hospital, for the community services. Less numbers are there and more population is there. Third, next is advanced technology. Advanced technology. So I can say every day there is new technology comes or new information comes. So nurse has to acquire the knowledge, skills, and maintain the update. If you are not maintaining update, you will be outdated, and it is harmful to you as well as it is harmful for the patient and profession. So learn the advanced technology, whatever is there. These are certain examples in a pictorial form. It is there, like workplace mental violence are there, human interactions. Sometimes there may be crises are there among the professionals or management or among the society members are there. Next, shortage of the staff, workplace health hazards are there, inadequate air, water, food, ventilation, light, other things, long working hours are there, recognitions, recognition in the form of certification, prestigious respects, or in the form of certain benefits. Recruitment policies are there. There are maybe certain tough recruitment policies are there. Positive environment, comfortable environment, or psychological environment is there. what are the solutions are there? Challenges will be there. There may be different challenges are there, but there are few solutions will prevent or overcome the challenges. First important maintain that practice regular self care. Practice regular self care. So every person should be healthy by good nutrition, exercise, recreation, physical mental activities are there as well as acquiring the knowledge. Second, put safety first. So wherever you are there, it may be at home, it may be at out of home or in the working place. You have to practice the safety measures, use the safety devices. Each and every action should be safety. Safetyness of nurse, safetyness of patient and co-workers. Next, practice good hygiene, personal hygiene as well as environmental hygiene, surrounding areas. So by the pollutions of air, water, food and other things, you will not get any diseases. Then stop the bullying and their tracks. So you have to find out opposite, not to get such type of the events and informing to the respective authority for proper action. Don't short staff yourself. So whenever there is too much shortage is there of the staff, don't work because it will not give adequate or standard care to the beneficiary. Be techno savvy. Techno savvy means you have to learn all the technology. What is the technology? How it is works? What are their advantages? Are there? What are their new informations are there? That technology has to learn. Last, commitment to the organization and profession. Service first. So commitment first you have to perform the work standard ways and then you have to have your self, maybe family or self. Trends in nursing. Trends means every time there will be changes occurs. So whatever the nursing was there in 1,000 year back, 100 years back, and present, and every 5 year, 10 years there will be too much changes occurs. These changes occurs because of technology, environmental changes, awareness about the health team members, and the information interaction of the global nurses. Within short time, the nurses or members they are interacting to each other. So trends, nurses shortage will be continue. So as much as it will be number also increases, new health needs are increasing. Health needs will be increasing or new requirement of even healthy person they will require nurse for the maintenance of the health. Nursing job members will continue to increase. So as the super specialties, different type of diseases, it is expanding from individual to the society health problems to the environmental health problems. So the working it will be increased. Increased number of online programs. So the technology made changes each and every areas. So online educational programs are there that has to follow how to get it, how to do it. Nurses will need higher education. So don't stop at the basic level because it's demand of the population, it's demands of the profession to have higher and higher education to maintain the standard as well as update knowledge and skill. Rise use of the telenursing. Telenursing means using the equipments from the distance level you are performing nursing activities through internet and computer or mobile services. Traveling nurses increase the specialization, super specialization is there. Self care for the nurses. Nursing informatics. So nursing related information so much is there. So the members they will guide what to take the information, how to implement, how this information is converted into the usable thing. Increase of the salaries and benefits. As you are having higher skill, higher education, higher knowledge, and when you are in demand, you will get higher salary and benefit. Multilingual nurses will be more in demand. Multi means many, those are speaking many languages, international language, English, as well as many languages. So they will be communicate to each and every members from the beneficiaries to management to the beneficiaries. Holistic care it will be there. So especially medical, this is treating the disease, but nurses, holistic care, taking care of the whole person as it is. It may be person, it may be family, it may be group. Then late retirement. So demand is there, the opportunities are more directly, indirectly enforced to work long time, even after retirement. Increased number of male nurses. So we are calling as a nurse or nurse for male nurses. So certain areas are there, they are having demands as well as they are also equally performing nursing activities. Evolution in the work area. Work area previously it was observed nurses were working in the hospital, but now they are working each and every area, different area from the home, school, industries, disasters are there, travelers are there. So so many areas are there. Intra-professional participation, teamwork, health team members as well as other teams are there. All together they have to work because health is a multifactorial and multi-aspect is there. Physical, mental, social, we are considering occupational. So intra-professional participation is also important or it will be there. Occupational health hazards and how to prevent it. So when you are working as any professional members, you will have certain health problems. Like police, they are standing long time. Military members, they are remaining away from the family members. They are working maybe underwater at the ice minus 20 30 degree temperature or at the high level of the sky. Navy members, so certain problems will be there, like injuries are there. Injuries are there because of especially occupational health environment. If it is not adequate, light, ventilation, the structures, safety measures of the various machineries or things. Second, occupational stress. Occupational stress occurs due to poor environment, workload is more, not ability of having certain technology using, so there will be stress occurs. And whenever there is stress occurs, it leads many health problems like diabetes, hypertension, or conflicts among the professional or management to the professional. Infectious diseases. So health setting, it is a area where so many infectious diseases are there. They will get transmitted from the members. Next, job violence. Job violence, shortage is there, overload is there, stress is there, high demand is there, or overworking is there. There will be fights among the professional members or in within the nursing professional. Job violences may occur. And chemical reactions or chemical poisonings, because they are using various drugs, chemicals are there. If they are not practicing safety measures, hand washing, other things, they will have certain chemical reactions. So injuries, occupational stress, infections, job violations, and certain chemical reactions. The health hazards are there, it is for each and every profession. Preventive measures are important. So how to prevent the occupational hazards? Use the safety measures. So where we are asking what are the safety measures are there? Suppose infected patients are there, like corona. They were using kit or whole body was covered. That is important. Follow the standard guidelines of working. So use the according to the guidelines. Don't shortcut of any procedure, any activity. It is harmful to the patient or you or maybe for environment. Then maintain the health by proper diet, exercise, and relaxation is there. Certain vaccination and prophylactic treatment is necessary for the nursing faculty. Vaccinations like especially hepatitis is there or any other infection occurs, they are getting the vaccination. Prophylactic, when you are working in the risky area of infections, they are given certain drugs which prevent the diseases. Orientation of the new staffs. Orientation of the new staff is important, along with there will be continuous monitoring. Supervision is there because still they are not aware about that how to perform the activity in a safe way. Then monitoring system and occupational hazards. So monitoring each and every event, why it is causes health problems to the nurses, what is the source, how many numbers are there, if event occurs, record it and take the actions. Next, appointment of the supervisor and safety officers. Supervisors, they will work with the new members or even the staffs or all the health nursing professionals, as well as safety officers. They will observe, provide the safety measures. Next, medical care and health services, health insurance are so important. So even with the certain measures, there may be chance of occurring any incidents. Medical care should be provided to the nurses, as well as every nurse should come under health insurance. Respectful nursing image in the society. After Corona, this is a real fact. So many members they are respecting to the nursing profession because everyone has observed, everyone has experienced that during Corona care, nurses have taken lot of efforts from home to the hospital everywhere. So the respect of the nurse it has to maintain. How there are some simple actions are there. First and most important that give self-respect. Every nurse has to give the self-respect that I am nurse, I am respectful members, respect to the professional and profession. So maintain the standard of working code of ethics of profession. Advertise of the nursing through the various mass medias are there, electronic media, print medias are there, or wherever you are coming contact with any members. Raise the voice of campaign, perform the various campaign members are there for the awareness, or sometimes it is for your demand, sometimes it is for oppose certain improper actions for health or for the profession. Standard knowledge and skill is the power. So the power has to keep what is the power of nurses? Standard knowledge and skill. And assertive in interactions. You have to give your opinion in a assertive manners. Don't be the shy, don't be the hiding your reactions. It should be expressed in a proper manner. So self-respect, advertisement, campaign, group unity, their interactions, standard care you have to provide get the knowledge and skills and assertiveness. So it will maintain high and high professional respect. Future nursing. So present we are observing last 100 years there was gradual change. Before that very slow changes were there. But nowadays the nursing profession, nursing activities will be changes very fast because of technology, environment and expectation of the each and every members. So what may be in future this is just imagination or based on the present situation we are thinking. So artificial intelligence and automated task of nursing. So artificial electronic machines are there. They are giving the information. They are giving the direction. They are performing the action like robots, robotic nurse. High demand of community health nursing because mainly she is covering the members at the home, school, industries, various areas. The focus of prevention of the disease. Nurse research and theorist. So researchers find out the new ways to economically provide nursing care and theorist means they will guide how to perform the nursing activities in different ways. Then geriatric nursing care. So as health services are increased, geriatric population is increased. Pediatric and geriatric we are considering dependent population. Involvement in the international nursing agencies. So international nursing agencies, universities may enter in each and every nations and they will run the various nursing programs. So the members has to learn the nursing profession at the international level. The local agencies, if they are maintaining the standards, it's okay. If it is not, inter- international agencies will disturb them. Then environmental health care nurse. So human health equally important is the environmental health where we are living. Nurses Day celebration is there. It is a one day that is on 12th May on the occasion of anniversary of birthday of Florence Nightingale. So uh, this is a one day celebrations. It starts and it will continue whole year. So what is the aim of celebration? To raise the awareness and importance of the nurses' role in the society and contribution and commitments among the nurses for the public. And the actions it will be performed through the mass media, print media, speeches, rallies, exhibitions, role plays, and various interactions are there. In summary, I can say nursing is a noble profession. Human care, status, income, and job it gives all together. So it becomes as a noble profession. Accept and face the challenges and trends in nursing. So there will be challenges, there will be changes, trends. You have to accept it, face it, solve it. Maintain good health and update the knowledge and skill of nursing. Follow the moral, ethical, social, professional, and legal norms. Follow the moral, ethical, social, professional, and legal norms. So, in conclusion, nurse takes care of each and everyone. That's why it is called as angel of the health, and it is need for everyone because mainly she takes care of preventive, promotive services. So it is needed for each and everyone. And if it is sickness, disease, they will take care of curative or rehabilitative services. This picture gives the proper meaning of conclusion. Everybody loves a nurse. Everybody loves nurse because she takes care of everybody. She takes care of everybody. This is one image and a note regarding respectful quoted by our former president APJ Abdul Kalam. In a speech, he said that nurses are angels of healthcare. Nurses of angels of healthcare. What he has uh, says through the oath, they told to nurses to say that I love my profession of nursing and its noble mission. So everybody has to keep in mind, every nurse, it is my profession, it is a noble mission. I realize removing the pain is a great godly mission. Pain, physical, psychological, or relational. I will treat all the patients equally with the kindness and care. I will take special care of at least 20 rural patients. So it may be as a professional members or apart from your professional duties. And I will respect to each and every member. These are some informations YouTubes are available. These are references where I have taken the information and I have included my personal experience. So I can say the thanks to the nurses for maintaining the health of each and every members. Especially I am thankful to the Education Institute of Global Professions, all the team members who are providing the me stage and promoting me as an international speakers and maintain the hospitality. Especially I am very much thankful. Those are attendees are there, participants are there. More than 1 hour they were with us and they are interacting with patiently and interestingly. Thank you, one and all.
Thank you so much, sir, for your rich content presentation, which can impact our knowledge seeker surely. After your presentation, I hope our knowledge seeker can learn something new, which was our only intention. Learn and grow together, IGP knowledge seekers. Once again, thank you so much, sir, for your presentation. Now, sir, it's time for our question answer session, which is the one more valuable part of our regular webinars. Honorable sir, please stay with us. After a short video, we will be back in our session part 2, which is the question answer part. Okay, sir?
Okay, thank you, ma'am.
Thank you. Dear Rajiv Knowledge Seeker, please ask your question in the comment box as much as you want to know from our speaker. Thank you. After question answer, we have webinar certification and online course competition. Dear IGP Knowledge Seeker, please ask your question in the comment box as much as you want to know from our speaker. After question answer, we have the webinar certification and online quiz competition. After short video, we'll come back again, so please stay with us. Dear participant, please ask your question in the comment box as much as you want to know from our speaker. After question answer, we have webinar certification and online quiz competition. Let's welcome back our speaker. Hello, sir. Welcome once again.
Hello, ma'am.
Hello. Our first question from Jartan Joy. Good day, sir. What is the hardest part of being a nurse?
Thank you, the participant who has asked this question. He has mentioned the hardest part. So, as the strengths and challenges are there may be challenges are there. Each and every challenge you have to face because it is a part of learning, and when you are learning, you will get certain rewards. The hardest part is that you have to stay in the profession, accept the knowledge, accept the skills and the systems. So when the systems sometimes may not be favor to you, but you can make the union groups, through that you can solve certain problems are there. When you are taking hard efforts to promote the nursing profession, it will be benefited to you, benefited to community and next generation. As a foundation, you have to take the hard efforts. It is a working is very hard because it is connected to so many members are there, and she is only most responsible for and accountable for each and every activity, each and every person. Thank
Uh,
you.
okay, sir. Thank you. Then our next question from Evelyn P. Wapiri. Good evening, sir. What do you think is the most distinctive characteristic of nursing as a profession? Thank you.
So as a professional, 4 to 5 points I told. First, very important that it is a specialized knowledge. So no other person, no other profession can perform certain activities. Second, the service oriented. Give the full preference to service first, then other things related to your personal and life. Third, it should be vital or essential for the population. So nursing is needed to each and every member, everywhere and for all time. And it is a growing profession, knowledge-wise, skill-wise, coverage-wise, specialty-wise. So these are the certain criteria are there, characteristics are there of the nursing as a profession.
Thank you, sir. Then our next question from Flomi Raghav Salvejo. Good evening, sir. What are the negative impacts or health effects of nurses' long working hours?
Thank you for this question. The impacts are there, as I told, health hazards are there, like it is a injuries are there, long working hours, like there are vein gets uh, swollen, like what is called as varicose veins are there. Then not getting adequate food, not getting adequate rest, so the digestion, rest, and other activities, other body organs will not function properly, but you are maintaining the good exercise, good diet, relaxation, you can perform the work comparatively more and more. And when you are imposed for long duration of the work, straightforward, you have to refuse it because it is harmful to you as well as others, patients, especially our beneficiaries.
Uh, Thank you, sir. Then our next question from Asia, Sir Dr. Kulgami, resourceful 6 a.m. What is 6 a.m.?
Okay, six M's are there. That means starting the word with M. That is man, nurses, different type of their material, whatever they are using, the educative material. Then methods, what type of nursing they are providing as a theory, as a nursing process or traditional way. Minutes, that is a duration, how much time they are working. Then measures, so through what ways they are performing the activities. These are measures, methods, minutes, money. How economically you are performing your activities. These are the different M's are there.
Okay, sir. I think we covered all of our question. There is no more question. Honorable sir, we once again thank you so much, sir, for your time in IGP. We have learned a lot from you with new topics. It will add some value to our day-to-day activity along with our academic and professional growth. Honorable sir, hope to see you again with a new topic and a new day. Thank you so much, sir, and take care.
Thank you, whole team of education in IGP members, especially you for compelling the whole session around more than around 2 hours. It is there,
Yes,
and
sir.
all the participants. I'm really enjoying with these agencies and interaction with you and all the participants through your platform. Thank you once again. Good night.
Thank you, sir. Uh, Sir, before you move to the next webinar certification process, if you want to leave this studio, you can.
I will stay, ma'am. If anything
Okay,
is there,
okay.
I will come.
Okay, no problem, sir. IGP Knowledge Seeker, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we will start our webinar certification. After webinar certification, we have an online course competition and quiz certification. IGP Knowledge Seeker, it's time for the webinar certification process, the most attractive and powerful part of our regular webinar. After a short video, we'll start our webinar certification, and after webinar certification, we have an online quiz competition and quiz certification. So please, everyone, stay with us. Hello, everyone. Uh, Now it's time for to give you certification code. Today program name is Nurses Angels for Everyone's Health, and the code is IGP3511, and the code is IGP3511. Without code, no one is eligible for certificate. With code, you can claim your certificates anytime. How to claim your certificate? Follow my instruction. First, you have to go www.eduigp.com. Then you have to click sign in. Then you have to log in if you already have an account, or if you are new, then you can create new account. Once logged in, click Free Webinars and select the webinar title, and click Continue Courses and get enrolled if you have not enrolled yet. Type the code in certificate code box, and today our certificate code is IGP3511, and the code is IGP3511, and click Get Your Certificate. It is auto downloadable in PDF file already. Just check it in your file manager or download folder. Uh, Dear participant, it's time for our online quiz. competition. After short video, we'll come back with our quiz session. To join our quiz session, first you have to go www.slido.com. Then you have to enter the code, and the code is IGP3. Everyone, please join with us, and please don't forget to mention your friends to join our quiz session. So let's enjoy our short video. Then come back again with quiz. Hello everyone, welcome back in our quiz session. To join our quiz session, first you have to go www.slido.com. Then you have to enter the code IGP3. To join the online quiz competition properly, please follow my instruction carefully. First, you have to go www.slido.com and find today quiz or scan this QR code for direct joining. And the quiz code is IGP3. And the quiz code is IGP3. We will pick your name from Slido, so join with your full name, which will directly print on certificates. Top 10 will be awarded with quiz comprehension certificates. Already 32 people join with us. We are still waiting for your joining, so please everyone join with your full name, which will directly put on your certificate. So please everyone join with your full name. And don't forget to mention your friends to join our quiz session. After 2 minutes later, we'll start our quiz competition. Dear participant, to join our quiz session, first you have to go www.slido.com. Then you have to enter the code, and the code is IGP3. And the code is IGP3. Please join the slide with code, and code is IGP3. And please join with your full name because it will be printed on your certificate. So please everyone join with your full name. now let's start our quiz session. First question is, how does the nurse get a diagnosis? Option 1, ask the patient. Second option, analyze the assessment data. And the correct answer is analyze the assessment data, and 74% people are right. Now we go for our in our dashboard. In the dashboard, the top one is Jordan Joy. Then you can see the, in second position we have Cherry, and third position you have Evelyn Perba Waperi. Now we go for our second question, and the question is, when can a nurse break confidentially? First option is when ordered to do so by the court. Option 2 is when a police officer asks. When can a nurse break confidentially? Option 1 or option 2? And the correct answer is when a police officer asks, and 30% people are right. And the top one is Jordan. Then you can see in the second position you have Cheryl. Sorry. In the first position you can see that Christiana is first top one. Then you can see in second position Jordan, and third position we have Cheryl. Now we go for our trinom question. And the question is, clinical reasoning allows the nurse to option 1, see the big picture. Second option is focus on details. Clinical reasoning allows the nurse to see the big picture and focus on details. And the correct answer is option 1, see the big picture, and 22% people are right. And the top one is Michelle Tarashina. Then we can see in second position we have Flomi R. Salvioso. In third position we have Kiwe Asia. Next question. When should the nurse assess pain? Option 1, whenever a full set of vital signs is taken. And second option is during the admission interview. And now you can see the correct answer. And the correct answer is option 2, whenever a full set of vital signs is taken. In the leaderboard, the top one is Flomi R. Salvijo. Then in second position, Mohammad Nasiruddin. In third position, we have Jordan Joy as Guillotina. Now we go for next question. When a patient refuses treatment, the nurse must option 1, ask one or two intervene to pursue them. Second option is respect their rights to refuse if they are fully informed of the options. And the correct answer is option 2, respect their rights to refuse if they are fully informed of the option. And the top one is Fahmi Arsalbiojo. Then you can see Muhammad Nasiruddin. Then you can see Jordan. Now I go for our sixth now question. When the nurse completes an assessment, this means option 1, collection of data pertinent of patient health. Second option is planning out of the care to be provided. And the correct answer is option 1, collection of data pertinent to patient's health. And 95% people are right. In the dealer board, the top one is Swami, then you can see Mahmoud Nasir, then you can see Jordan. And the next question is, what message does the nurse bring Romeo? Option 1, Juliet has decided to not marry him. Second option is Juliet wants to marry him. And the correct answer is option 2, and 52% people are right. Now you can see in the leaderboard, the top one is Dr. Albert, then you can see my Michelle Tarshana. Then next question is, was the first American licensed nurse? Option 1, Mary Elijah Mahoney. Second option, Isabella Baumfree. And the correct answer is option 1, Mary Elijah, and 86% people are right. In the leaderboard, the top one is Dr. Albert. Now we go for our next question. How long was Mary Elijah a nurse for? Option 1, 35. Second option is 40. How long was Mary Elijah a nurse for? Is it option 1, 35? Second option is 40. And the correct answer is 40, and 57% people are right. The top one is Dr. Albert. Then you can see second position we have Michelle. In third position we have Evelyn. Now we go for last and final question, and the question is the nurse is the center of the healthcare team, right? Option one, the patient is the center of the team. Second option is my mom is the center of the team. And the correct answer is the patient is the center of the team, and 86% are right. Congratulations, Dr. Albert P. He's our top one. Then in second position we have Michelle Tarashina. In third position we have Evelyn Parva. In fourth position we have Christiana. And fifth position we have Marfitili E. Apostol. Congratulations, our top 10 quiz competition winner. Congratulations again. Slido will take a few minutes for finalizing the result, and after that, we'll issue our online quiz competition certificate on our official Facebook page and group. Congratulations to our webinar online quiz competitioners. Slido will take a few minutes for finalizing the result, and after that, we'll issue our online quiz competition certificate in our official Facebook page and group. And the group and page is Institution of Global Professional, and the group is and page is Institution of Global Professional. At the end moment of our session, we can say properly, feed your skill, never stop learning, cause life never stop teaching us. Be happy and stay safe. See you again and again. We want your presentation in every program. If you want to live a happy life, tie that to a goal, not to people or things. Albert Einstein. Before I say or hit the end like button again, wants to thank to all IGP Knowledge Seeker for your active participation as always. See you in the next session. Thank you everyone.